Hi everyone, my name is Pearl van Lonkhuizen and I'm a PhD student at the Leiden University Medical Center in the Netherlands. Today I will give a brief overview about our project in which we will develop an eHealth platform for Huntington's disease patients and their partners. I will give this presentation together with my colleague Nico Vecht, which you will see later on. In our international GP&D funded project, our aim is that not the patient has to travel, but the knowledge does. We therefore want to develop a European eHealth platform for HD patients and their partners targeting quality of life within the home situation. We will conduct this study in different countries, including Germany, Italy, Czech Republic, Scotland, Ireland, and the Netherlands, so that we can develop a multilingual platform that will be suitable in these different healthcare systems and cultural contexts. So how are we going to do this? We will use the principles of user-centered design, which basically means that you already include the end users during each stage of the development and design process. We do this because end users are the experts of their own lives. In this way, you can include functionalities that are desired by the end users. And this will increase acceptance and uptake later on. Who are we including? We will include HD patients living at home, partners of HD patients, and healthcare providers across all countries. In this way, we will ensure that the eHealth platform fits the needs and preferences of all these three groups. Our user-centered design process consists of 3 phases, which we will now briefly go through. In the first phase, we will explore the needs, desires, and wishes of patients, partners, and healthcare providers. We will do this by giving them synthesizing assignments that encourage them to think about quality of life and HD-related experiences. At the same time, these assignments help to better express these experiences during the interviews that we will have with patients and partners and the focus group sessions with healthcare providers. In these sessions and interviews, we will go into more detail about their perceptions of quality of life and other HD-related experiences. Due to COVID measures at the time, the majority of these interviews and focus groups were performed online. I will now provide a brief overview of the preliminary results of the Dutch interviews that have already been performed. We did the interviews with 12 patients, 12 partners, and 12 healthcare providers. And what we see is that there were really 3 major discussion points. People talked a lot about HD-related experiences. For instance, knowledge about HD, knowledge that they have themselves, but also that others have in the surrounding, but also the lack of knowledge about Huntington's disease in general. People really talked about symptoms and how to cope with that. And a lot of coping strategies that were discussed were talking about HD, but also contributing to research is something that participants in our sample really valued. Another major discussion points were factors that were influencing quality of life. They were really in the social atmosphere. So they really talked about social relationships and also peer support. Not only patients with other patients, but partners really talked about the need for peer support with other partners from affected individuals. So you can imagine that we've collected a lot of information from all these interviews. And this will be the starting point for phase 2, in which we are going to develop and evaluate concepts of the eHealth platform. And my colleague Nico, our user-centered design expert, will tell you more about these sessions right now.
Thank you, Pearl. We indeed involved patients and partners in the development of ideas and concepts for the eHealth platform. We did this in 4 sessions, co-creation sessions, with separate groups of patients in different disease stages and partners of patients in different disease stages. To prepare them, we asked them to fill in a booklet again with sensitizing assignments. But before that, we first had to develop the design goals that people would be working on, and that would also be communicated in these booklets. So based on the interview results, we defined the 4 different design goals. First one would be to increase the accessibility of care. Second goal was to allow people to navigate through the knowledge landscape regarding Huntington's disease. The third goal would be to support coping strategies that many people explained or told about in the interviews. And the fourth would be to provide people with tools to cope with the symptoms that come along with Huntington's disease. So regarding increasing accessibility of care, we heard that it is quite a barrier to request for help, and what we would think that we could provide with a digital platform is to lower the threshold through online support by providing smaller steps towards care provision. The second goal was related to navigation through the knowledge landscape. Many people told us that there is a lot of information out there on the internet, but it's not tailored at the moment to the situation that people are in. In many cases, they also say it's quite shocking, confronting information. So we would like to provide reassuring information. Also, they miss answers to the specific questions that they have. Most of the information is general. And what they also value a lot is experiences from peers, but also just the sharing is a reassuring activity. Then about the third goal of supporting coping strategies. So we heard many strategies coming back frequently in the interviews, such as organizing your care path, contributing to research, following medicine developments, also just sharing your experiences regarding Huntington's or your worries about it with others. And last but not least is also just not forgetting to enjoy the moment, the disease take over your life. And then the fourth goal would be to provide patients and partners with tools to cope with the symptoms. And we were then thinking of some form of web shop or overview of all kinds of digital tools that could help people. So with these four directions or four goals, we developed the sensitizing assignments in booklets that were sent by post to the participants. And in these booklets, there were scenarios with the first two images providing a short story about a problem or an issue or a worry that could happen. And in the final image, you see positive end results or the goal that we would like to eventually achieve with our platform. And in the middle, there was a blank area where people could fill in their ideal experience, how they think it would be worthwhile to go from the problem to the solution. So in these sessions, of course, we first introduced the project to them, and then we asked them to introduce themselves with a scenario from the booklet to explain what scenario they like most. And then we split it up into duos, go into separate online rooms with the facilitator, and this PowerPoint template, where together with the duos, the facilitator would draw the ideal experience scenario that the participants were thinking of in relation to a digital platform. So some examples of the outcomes. This was, for example, a scenario that was drawn with manifest patients. They were thinking of searching for information. And then, for example, also an outcome of a scenario with partners of pre-manifest patients. They were thinking of this knowledge landscape and what then, for example, an app with a movie could look like. So in this way, we captured many of those ideal scenarios, what they would like. So based on that, we defined a final concept for the HD platform, which we think should then be a trusted safety net or function as a trusted safety net for everyone who encounters Huntington's disease in some form in their private lives. And based on what our participants told us, this platform should first of all be empowering. The information should be realistic, but also open and without obligations. And then, of course, this reassuring character, it should be calming, not confronting or shocking. The information should definitely be non-medical and also provide a lot of practical information. So based on that, we defined what the priority would be to develop in the platform, which would be HD help desk with understandable general information, answers to frequently asked questions, and referrals and contact information. So that's actually the thing that we are going to start with in phase 3. And furthermore, we developed elements of general information with the users, specific information, contact information, and ideas for tools. So those are directions for further development. So currently in this phase, the concept phase, we are still working on specifying the platform design. We're also planning to co-design the platform content with healthcare professionals, and then eventually evaluate the platform design with patients and partners again, so that we then are really equipped to develop a true prototype of the platform that can eventually be tested. So back to you, Pearl.
Yes, thank you, Nico. So after we analyzed all these data from all countries, we will start phase 3 of the project, in which we will further develop the most promising ideas resulting from phase 2 into a prototype. This prototype we will also extensively evaluate with all different user groups in the different countries. And this will be an iterative process. So you have evaluation, readjustment, re-evaluation, readjustment, etc. And the findings from these tests will result in a final design proposal, which we will then further develop into a fully functioning eHealth platform for implementation. So yeah, this was basically it, very briefly. But thank you for your time. And if there are any questions, please don't hesitate to ask.